Hey everybody, it's Zach Meyer from Neuma Psychological Services, and I wanted to check in with you in this crazy time, just with some quick updates and some quick suggestions for you. Number one, Neuma's open. We're meeting with people, not in person anymore, but we have a great telehealth platform in place that allows us to meet with you on your phone or tablet or computer, and it's been working really well. We kind of cycled through a few options. A lot of our clients were kind of our unwitting early beta testers, and we've settled on a product that really works well for them and for us. It's really easy. You just click on a URL and we're talking to each other. So if you haven't met with us in a while but you'd like to, we can do that. If you stumbled upon this website looking for therapy and you're not in therapy right now, and you're wondering if that's possible, it's possible. We can start meeting with you. It's going to be virtually, but we're happy to do that. So in terms of the things that we would advise you to do, number one, admit to yourself that it's okay that this is hard. There is no correct way or right way or proper way or most efficient way or most mature way to deal with a pandemic like this. None of us have life experience with this. We're all kind of winging it and gaining understanding for what it feels like as we go. So none of us are very skilled yet at dealing with this kind of situation. As such, don't expect yourself to feel super skilled. Expect that it's going to be hard, that some days will be harder than others, and that you're going to have a lot of emotions involved. Most of those emotions might be kind of negative, and that might be kind of uncomfortable. They might even be some emotions of grief, which is kind of the fancy word for feeling sadness at the loss of something. And if you think about it, we've all lost a lot in the last few days. It happened really fast, didn't it? We've all lost access to people or places or routines or income that kind of gave some structure to our day, helped us feel positive, helped us feel secure in the world. That's hard. Often when that happens, one of our sources of comfort is being able to think about future things that we can be more sure of, that we can look forward to. And unfortunately, in this situation, it's hard to do that too. We can't realistically say to ourselves, well, we know this will be over by next Thursday when we've scheduled that vacation. Or, hey, at least in summer, life will be like this. We're not exactly sure because none of us can predict the future. So we've all got some grief about our present situation and about the future because it's uncertain. So if that's you, that's okay. That's normal. There's no better way that you should be coping with this outbreak than how you are and how you're feeling. But there's three things that I would recommend you try. Three general things as you cope with this pandemic. Number one, as much as you can, try to maintain some kind of structure or schedule or routine in your day. We humans thrive on routine, and most often, usually, our days are full of it. We get up at the same time, we go to the same place for work, we eat at the same times, we see the same people, all that kind of thing. Our brains love routine because they make life feel stable and predictable. And right now, what we're all experiencing to some extent is a disruption of that predictability and that routine, and our brains don't like that. So as much as you can, recreate those things at home. If you usually work out 3 days a week at your favorite gym that's now closed, see if you can recreate some kind of workout routine at home at the same time that you would normally be at the gym, and hold yourself to it. If you usually go out to dinner as a family on Friday nights, that's obviously one that you can't continue to do outside the home anymore. Maybe Friday nights you now all cook a meal together at home. So whatever you can do to provide some structure to your day, it will help you cope. It'll help you feel more in control of what you can control, which is kind of the choices you make throughout the day. The second thing I would advise you to do is to stay connected with loved ones, family members, friends, coworkers. Humans don't do well in isolation. Even if you're an introvert and you're kind of loving this alone time, that'll probably reach a limit if it hasn't already. And even if it hasn't, you still need people. You still need to connect with the people you care about and let people who care about you connect with you. We were built for relationship and community. So take advantage of all the amazing modern technology that exists that allows us to do this kind of thing. I've heard of kids having Zoom calls with their classmates just to kind of connect with friends they can't have playdates with. I've heard of parents having virtual happy hours after their kids are all in bed at night to kind of connect and commiserate about how this transition has gone. That kind of community is really important to maintain if we can. So I would encourage you to do that as well. And then the last thing I would encourage you to do is to heed the CDC's advice and your local government's advice in most places and stay home. Though we've never seen this disease before, what we know from past pandemics and from epidemics around the world that haven't necessarily touched the US is that this kind of social distancing, not interacting with other humans more than we absolutely have to, is a really effective way to not eliminate the spread of the disease, but slow it. And the reason that's important is because we know a few percentage points, few members of the public who get this disease are going to require more advanced medical care to survive it. And if more people require care than we have beds to provide it, we've got a problem. And so by slowing the spread, we are limiting the number of people who will need that kind of advanced care in the hopes that we've got the beds and the facilities to meet that need. That's what we're doing. So even if you're not worried about yourself and your own health, stay home so that you don't spread this disease to someone else whose health might not be so great and who might be more likely to need to spend some time in a hospital. So that's what we've got to say for you at Neuma. We're thinking of all of our clients. We care about you. We know for many of you who we've continued to talk to how this is affecting your lives. We're all in this together. We are all deeply affected by this. And we at Neuma are here to support you. Your friends and family are there to support you. So reach out to them. Reach out to us if you need to. And hopefully we'll get through this sometime, eventually, together.